Assalamu alaikum wa rahmatullahi wa barakatuh. Our esteemed viewer, once again, welcome to your program, Health Check, a program where we bring medical personnel to give you medical advice regarding their areas of expertise. And today we have Brother Bahi, who is a physiotherapist, will be helping us understand osteogenesis imperfecta, a problem that affects the bones still. We are still tackling the human skeleton. Brother Bahi, most welcome.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh. Straight away to the topic of discussion, Dr. Bahi, osteogenesis imperfecta. It is a medical term. We need to understand what it is.
Yes, osteogenesis simply means formation of bone.
Formation?
Of bone. Osteogenesis imperfecta is a heterogeneous group of congenital, non-sex-linked group of disorders.
Okay.
Yes. It usually affects the synthesis of type 1 collagen. So collagen is a very important constituent in the formation of the extracellular matrix of many tissues in the body. These tissues include skin, the bone, the tendons, and the sclera.
Okay.
Yes.
Thanks a lot, Doctor. And now this brings me to the risk factors and the causes of this ailment, osteogenesis imperfecta.
Osteogenesis imperfecta, it's commonly known as a hereditary disease. This is, it commonly occurs due to secondary mutations in the collagen 1A1 and collagen 1A2 genes. These genes, if the mutation occurs, they result into the production of bone, that is bone or tendons or skin that is defected. The risk factors of osteogenesis imperfecta, one of it being a hereditary issue is if it results in two abnormal genes. That is one gene from each parent. That is one gene from each parent. So if one parent has an abnormal gene and the other parent too has the abnormal gene, there is a 50% chance that the child or the offspring will get the disease.
Okay.
Yes. Most times this is a congenital thing. It is not something that you acquire after being born. Most times, even before birth, if the mutation happens between those genes that are responsible for the collagen type 1 synthesis, then you will be born with it.
Okay.
It is not something that after you're born you will acquire, no. That's why we refer to it as congenital.
Okay.
Yes.
Thanks a lot, Dr. Bahi. Now let's talk about the complications that comes with this osteogenesis imperfecta.
The complications are quite vast because of how it affects I wouldn't say major tissues, but these tissues are so important to the body: the skin, the bones, the tendons, and the sclera. The sclera is the white part of the eye. So when you have osteogenesis imperfecta, the white part of the eye can appear bluish or gray in color.
Oh.
Yes. Skin-wise, the skin can be too affected. The bones tend to be weak because the collagen that is a main constituent in forming the extracellular matrix is a defected one. The bones tend to be very weak. Okay. And because of this, you'll see individuals suffering from what we just discussed, or in another topic we'll discuss of osteoporosis.
Okay.
Yes. So what happens in osteoporosis can also happen in osteogenesis imperfecta. Yes. I would say someone who has osteogenesis imperfecta will most likely develop osteoporosis. Though someone who has osteoporosis will not develop osteogenesis imperfecta.
So one of the two leads to the other?
Yes.
Okay.
Because this is something you're born with. So when you have osteogenesis imperfecta, you'll definitely have fragile bones, and you'll have symptoms that also refer to osteoporosis, things like fractures.
Okay.
The other thing is the teeth. Osteogenesis imperfecta affects the teeth.
Sure.
So you'll have translucent, weakened teeth.
Okay.
Or they can also change in color into bluish gray or yellow. The other thing that osteogenesis imperfecta will affect is the hearing. But most importantly, it will affect the person's ability to move or perform daily activities. So it will affect their ligaments. Their ligaments will be very lax.
Okay.
It will affect their joints. It will also make them predisposed to having a short stature. What we explained in osteoporosis of loss in height will happen in osteogenesis imperfecta as the short stature. But the other thing is they will have a vulnerability in bruising. That is how it affects the skin. The skin is weak.
Okay.
You can easily get bruised.
Okay.
Yes.
Let's now go to the signs. How can you tell that such and such a person has osteogenesis imperfecta?
What I just explained above, the four major clinical features that characterize osteogenesis imperfecta. But each individual represents differently because it also has types, very many types. It has type 1, type 2, type 3, and type 4 to type 8 are most times grouped together.
Sure.
But most of the things that you will see are fractures. Fractures are a very common part.
Okay.
You'll see people having things like respiratory complications. You'll see people having sarcomas, osteogenic sarcomas are what we call tumors of the bones.
Okay.
Yes, because it affects the bones in a way that is not normal, they tend to have that high chance of developing these tumors. Yes. The other thing is, I already explained it, is a short stature.
Okay.
Yes. The other would be the sclera changing color, the white part of the eye. Most times it will be bluish or gray in color. Yes. The other issue would be if we to use X-rays, their bones will be in a different form. They will have quite the deformities because of that weakened. You see, in osteoporosis, it is only the bones that are weak. But when you come to osteogenesis imperfecta, you're not only affecting the bones, but you're affecting the tendons that support the joints. So if the joints are affected, the whole skeletal structure will be affected in terms of its shape.
Okay.
So they will have widespread deformities in their body. So if you're to view it on an X-ray, it will be very apparent. Even if you don't know how to read it, you will definitely know that this person has an issue.
Okay.
Yes.
Thanks a lot, Dr. Vahi. Our dear viewer, this is the time that you're coming in. This is the time we need to hear from you. Let's see where our cameras landed to see the views from our viewers. Let's hear from you.
Assalamu alaikum wa rahmatullahi wa barakatuh, my fellow Muslims. My name is Kiwanu Kafad, and my question today is osteogenesis imperfect hereditary?
It is. Is osteogenesis imperfecta hereditary? What is your take on this?
It could be grouped as hereditary, because hereditary is that kind of disease that comes after there has been some alteration in the genetic material,
Okay.
which genetic material is then passed on to the offsprings. Yes, so Osteogenesis imperfecta is a hereditary disease.
So the question is the answer itself.
Yes, you could say that.
Okay.
Because even in the definition, it is termed as a genetic disorder in some definitions. And genetic disorders are those that can be transferred from their parent to the offspring or not. Okay. So osteogenesis imperfecta can be both a genetic and a hereditary disorder.
Okay, Jazakallah Sanan Jaza, Dr. Bahi. You have now diagnosed someone, found out they have osteogenesis imperfecta. They are living a hard life. How do you advise them to cope with this disease?
So most of the times this shows in infants.
In children.
So advising them would be a little bit not something that is very subtle.
Okay.
Or that would be very straightforward.
Now,
but what we usually try to do is improve and try to maintain what they already have. Because this is something that already happens when they are born. Some of these changes are more like permanent.
Okay.
So we try as much as possible to maintain what they have and not lose it.
Not to worsen.
Not to worsen it.
Okay.
So yes, we still do a lot of exercises in terms of strength training, balance training, flexibility, but more so we try to give them adaptive devices. Okay. Because some of the deformities have gone way past the normal stage that could be reversed. So we try to give them assistive devices to help them cope with the deformities. Okay. This could be like canes or walking sticks or braces. They could be sometimes we give them walkers. Okay. Yes. The other thing is, of course, yes, if they are old enough to perceive information meaningfully, yes, we do try to counsel them. If someone has a negative mindset towards their disability, it tends to really affect them in terms of progression. If someone believes they may not get better or they will not get better, however much you apply your physical interventions towards progression, because of that innate belief, it affects their body's ability to progress. Okay. Yeah, so if they are able to perceive meaningfully, we, yes, communicate with them. And the good thing is that because osteogenesis imperfecta is mainly affecting bones, it is not affecting their brain, so their cognition is okay, their sensation is okay, and their coordination. Unlike patients who have neuro or who have brain issues, because for brain issues, training them movement-wise becomes a little bit harder. Okay. Because it is not just weakness or disability or deformity they have in the joints. They are not able to sense where their joints are. They are not able to coordinate their movements, and their cognition sometimes is impaired. But for people with osteogenesis imperfecta, that is not there. Okay. It is only at the joints that is the problem. Okay. So that gives an added advantage in trying to improve their health. Yes, so if we are to train them, it will become a little bit easier. Though some of these damages may be permanent, yes, but that is sort of the good news. It does not become as grueling as you would be working with someone who has brain injuries. Okay. Yes.
Brother Bahi, now we find the unlucky ones. Yes, there is a saying, prevention is better than cure.
Yes.
But according to what you've explained, this is something that is genetical, right? If I can remember, or if I could remember, it is something genetical. I mean, someone is unlucky since they're still in their mother's wombs. We find that they have contracted this disease when they are still babies or before they even knew they exist. What could be the treatment that you have for them?
The treatment, medicine-wise, yes, there are treatments that are designed to try and help improve the strength of the tendons that have been affected.
Okay.
If the bones too are affected, but as I already explained, calcium is a very important component in trying to improve the strength of bones.
Okay.
And since the bones are fragile, we want to make sure their bone strength is good. We improve their bone mineral density.
Okay.
So yes, there is medicine that is directed to that, but we, as earlier on stated, we can also try to improve their calcium intake or vitamin D.
Yes.
As we are doing the exercises to improve their physical capacity, we also have to try and make sure their system internally is functioning well and it is being improved to try and progress their betterment. Because this is a person who is young, and they have much more years to come for those who are able to survive past, yes, and able to live into adulthood. We want to make sure by the time they reach into adulthood, they are able to participate among their peers to a state that is near equal. So yes, we try as much as possible to try and improve their bone health.
Okay.
Yes, and since the body is still young, its regenerative capabilities are a bit better. Yes.
Okay.
So yes, there is a chance for them to improve as long as the treatment is started early or the detection is started early. Yes.
Doctor, unfortunately, this is the time I have to call off the program. It's very sad, but it has to be. Before I call it off, any concluding remarks or any advice before we sign out?
You would wonder if this disease in a way could be avoided. Yes, with latest machines and technology, you could do screenings before. These days, people tend to do screenings to see the probability of them producing children with disabilities.
Okay.
And if there is a probability that you're going to do so, yes, you could have counseling and medical attention given to you to try and help reduce. Yes, but also this happens. Also, this could be an issue of people not going for antenatal. Okay. Antenatal is a very good program put for mothers, because during that time it is a very crucial time. Because if there is any negligence that happens during that time, it can affect the child, which child is going to be affected for their whole life.
Okay.
Yes, so this in a way can be avoided by doing prior screenings, yes, between married couples, or making sure when someone is pregnant, they do attend the prescribed medical services for them. Okay. Yes.
Jazakallah ahsan al-jaza, Dr. Bahi, for the advice. For the mothers, you realize you're pregnant and you have the capacity in as far as money or financial heights are concerned, you have a chance to go and test or check to see whether you'll have a baby with some disabilities, and you'll be advised in this regard. So you can prevent it. That means you can get rid of it completely. Unfortunately, this is the time I have to sign out. I remain your host, Nambali Bashir, and until we meet in the next episodes, inshallah, assalamu alaikum wa rahmatullahi wa barakatuhu.